Welcome to today's session. In this video, we cover 10 high-yield MCQs on leukemia, perfect for MLT, biomedical science, nursing, and medical students.
1. Which of the following is a hallmark of acute leukemia? A. Mature neutrophilia. B. Thrombocytosis. C. Presence of blasts in blood and marrow. D. High LAP score.
Our rods are classically seen in A. All BAMLC CMLD Calais. 3. The Philadelphia chromosome is associated with AAMLM3B Calais CCMLD all only. 4. Which stain is most useful to differentiate AML from all? A. PAR BMPOC Prussian blue. D. Giemsa. 5. Hypercellular bone marrow with greater than 20% blasts is diagnostic of A. Calais B. Chronic leukemia. C. Acute leukemia. D. Hairy cell leukemia.
6. Smudge cells are commonly seen in A. Calais B. AMLC all DCML.
7. Basophilia and markedly elevated WBC count, greater than 100 times 10 to the power of 9, L, suggest A. All BAMLC CMLD Calais. 8. Which of the following is a complication of tumor lysis syndrome? A. Hyperkalemia. B. Hyperuricemia. C. Hypophosphatemia. D. Hypercalcemia. 9. Block positivity on PAR stain is characteristic of AAMLBC MLC all D Calais. 10. The most common childhood cancer is AAMLB all CCMLD Calais.